16-year-old boy, new rash, mild sore throat, and then we see the papura on the both lower extremities, proteinuria and hematuria. So protein and also some blood in the urine. So what does this guy have? He's got leukocytoclastic vasculitis with IgA and C3 deposition. What is this? HSP. This is HSP. Let's describe HSP. It's a small blood vessel disease where you have an IgA immune complex deposit. That would be a type 3 hypersensitivity reaction because their complex is deposited after an infection. This kid had a sore throat. So the infection will go and it'll lodge places. The purpura, the purple skin spots, the blood will leak from the small vessels and it'll cause that. The joint pain is seen from the inflammation in the knees and the ankles where the depositions occur. Kidney problems, blood and protein in the urine, IgA nephropathy, for instance. Belly pain, gut and blood vessels can also get inflamed. So the inflammation, the immune deposits just being put everywhere. No fun. Dead neutrophil debris, leukoclastic vasculitis. That's what that means. And our AGA and our C3 depositions are the immune system attack on the vessels. So it's just going to attack the vessels. So let's kind of break this down and some other answer choices as well. So we know it's a type 3 hypersensitivity reaction. We know it activates complement, so C3, that causes inflammation and vessel damage. We know that it has these leukoclastic vasculitis and fibroid necrosis. Why? Because fibrin deposits in the wall. And there's a perivascular neutrophil and nuclear debris and the depositions. Okay, but why is it not A? The intravascular fibrin thrombi without inflammation. Well, that'd be disseminated intravascular coagulation, DIC, because then we have a bunch of clotting and bleeding, but HSP has normal platelets, right? So this thrombi, where are you getting this thrombi from? The thrombi would be if there's tons of clotting, and that's not it. Obliterative endocarditis, endarteritis with lymphocytes and plasma cells. So that makes us think of syphilis, a tertiary syphilis, seen in syphilitic vasculitis. And so syphilis causes a diffuse macular papular rash on the palms and also the soles. So you would not be seeing this here. This would be a syphilis association with tertiary syphilis. And perivascular necrotizing granulomas with eosinophilic infiltration. That's eosinophilic granulomatosis with polyanginitis. That's EGPA or Churg-Strauss. So that affects adults, and they have asthma and eosinophilia. So that eosinophilia, Churg-Strauss is what you'd be thinking. Transmural granulomatous inflammation with elastic fiber destruction. That would be your giant cell arthritis. And that is a medium to large vessel. I like it because it's giant cell, affecting the older adults with headache and vision loss. And IgA vasculitis affects the small vessels. Transmural granulomatous inflammation with elastic fiber destruction. That's going to be your medium vessel or large vessel vasculitis. Okay, hopefully that was helpful. If it was, like and subscribe.